And as we celebrate Pride Month, local organizations are educating the community about the impact the COVID-19 pandemic has had on HIV in the Black LGBTQ plus community. Dean King joins us now for this week's For the Culture. Hey, Dee.
Hey, good morning. So we all know HIV can affect anyone, right? However, Black and Hispanic people are disproportionately affected by HIV compared to other racial groups. Now, according to the CDC in 2018, Blacks made up 13% of the U.S. population, but 41% had HIV. Other social and economic factors like discrimination, income, and education make those inequities worse. The COVID-19 pandemic hasn't helped either. Communities of color have seen lack of access to testing and treatment. The National Coalition of 100 Black Women Tampa Bay chapter partnered with Positively You and other organizations to educate the community about these issues. Both orgs say continuous education is the key to ending disparities surrounding HIV in the Black and brown LGBTQ plus community.
We have to come together to be more supportive of one another. Just again, going back to that stigma and breaking the dysfunction of we don't talk about things or we keep it secretive, but that has to stop. So eventually it has to start somewhere.
To bring the education to the people, to let them know what services are available to them and what resources are at their disposal in order to get them knowledgeable and empowered to live healthy lives.
Now, both organizations are nonprofits led by minorities. Positively You, they specifically provide support for those living with HIV and prevents the spread through counseling, testing, and case management. So great organizations here. Yeah. More details on our website.
Well, Antonio was talking about resources that can help. How are local organizations helping out with this?
There are so many, DACO being one of them. They actually just go into the community. So they've gone mobile like many during the pandemic, going into these communities of color and providing testing and access to HIV treatment, which is huge, especially for people who are battling or suffering from this disease.
Very important. All right, thanks, Dan. For the Culture this week, David.